Hi, I'm Dr. Raghu Athre with Athre Facial Plastics in Houston, Texas. Welcome to the next episode of Plastic Surgery Unplugged. So, what we're going to chit-chat about today is the state of plastic surgery, specifically facial rejuvenation, in 2026, and what are some trends I see coming up in the upcoming near future. So, stay tuned, listen, and follow along. And you know that if you have any questions, always feel free to reach out, DM us, or get us through any of our other channels and modalities. So question one that we have gotten through our mailbox is, are fillers going out of style? And I think the answer to this question, if you hold my hand to the fire and say, I need a yes or no, I'm going to go, yes, they are going out of style. However, when we look at it, I think the answer to that question is just a bit more complicated than that. So when we delve into this, let's kind of go for a little bit of a historical background. I'm even going to give you my own personal historical background. So if you happen to come and see me, let's say, give or take, 15 years ago, and you had just a little bit of volume loss in this area and said, hey, Dr. A, I'm really looking to volumize this area and rejuvenate this area, what would you do? My first go-to would be a hyaluronic acid filler. Now, however, as I've kind of matured as a surgeon, gotten more data, done more research, done all of these various things, I'm going, these fillers are not as benign as they are sold to us. So when we look at the fillers and we look at all the marketing hype and the buzz and all that kind of stuff, what happens is it's kind of sold to us as something that, here's a quick little pick-me-up. It goes away in 10 months-ish, 11 months-ish, and you get to start over and try it out. Well, as I'm doing more and more facelifts, more and more facial rejuvenation, more and more surgical procedures, and I'm seeing more and more patients who have had fillers because they have become that ubiquitous, I'm seeing that the surgical field, the actual anatomy, the tissues, are not going back to normal. So many of the times as I'm dissecting through there, first of all, the tissues are harder to dissect. There's more scar tissue, they're a little bit more stuck together, they're crispy. I think that's the word I like to use, is this crispy. And many times I'm even seeing filler agent that's residual, that's hanging out, okay? So therefore, when we look at that, I am really walking away from the filler and going towards revolumization with fat. I had a patient come to me the other day. She's a patient of mine who's been a patient probably for 17 years. I did her very first eye filler treatment 15 or 16 years ago. And she is, about once every year and a half, she comes in and says, hey, I'd like a little bit of filler. Last couple of times I've told her, hey, listen, I really think you should go for fat. And we had a long talk and she agrees. She's like, yeah, now I see where you're going with this. And she's seeing some of the sequelae of the fillers with the kind of the bluish undertone to that area over years and years of filler. So maybe there is a possibility that I see a biased cross-section of the public, because since I'm such a kind of an anti-filler, if that's a word, an anti-filler convert or whatever that noun is, I see a lot of patients who go against the filler threshold and are wanting to do more natural revolumization with fat or surgery or whatever those options look like. So the long and the short of it is, I think that there is definitely a greater trend going away from fillers, but I think to say fillers are gone and done with, I think that's really not the case. If you look at the global filler volume is actually going up, because I think that it is also an easy procedure to jump into. So it's kind of one of those starting type treatments. And as the overall socioeconomic class of places around the world is increasing, it gives access to a large number of people to come in at the first level of aesthetic treatments. And I think That's where they start with this Botox Dysport and then shortly afterwards filler. So the long and the short, I think we're definitely trending away from filler, but the caveat is that may also be just my bias of the patients that I see. So if we start looking at what patients are asking for, I think there's a couple of trends as we're moving down the timeline. When we looked in, let's even start this like 2019, 2020, and you started looking at facelifts. Facelifts were really just a facial rejuvenation treatment. So what do I mean by that? The standard patient that would come in was about 60 years old and they'd say, hey, I want to look younger, blah, blah, blah. Okay, and that was your standard patient. But now we're really seeing the facelift being changed to more of a facial anatomy changing procedure. And what do I mean by that? So for example, what a facelift really does is changes the volume to a little bit higher up, more defined jawline, more defined neckline. So you're seeing 35-year-olds that come in and say, hey, listen, I'm not old. I'm not looking for rejuvenation, but I don't like my anatomy. I'm feeling too full down here and I've got a little laxity in the neck. And they're okay when you tell them, hey, listen, I can fix that. However, the term that we use, the name of that procedure that we do to fix that is a facelift. If I said the same thing in 2020 to a patient, I think they might shoot me. I mean, they may have gotten really angry and upset because there was a lot of pressure against this. And the facelift was really looked at as a rejuvenation procedure. Today, we are seeing younger facelifts. Now, I think that the trend is coming towards doing so many facelifts that you really need to kind of look out for those, what I call the good surgeons, right? The guys who are willing to look at patients and go, yes, you need ... a facelift, or no, you can get away with doing something else. So I think that that's a big trend. The second major trend that is kind of linked to this is more and more of the invisible looking facelift. So we're doing quite a few of these endoscopic facelifts that have no incision in front of the ear at all, even though that incision in front of the ear was so amazingly camouflaged that you couldn't even tell the incision. Imagine being able to move this anatomy, moving that mid-face fat pad up through an incision way high up in the temporal region and having absolutely zero scar. So it's kind of linked back to that original idea of let's look at this as an anatomy changing procedure rather than a rejuvenation procedure. So those are two major trends. Three, I think in 2021, 2022, there was a lot of buzz about buccal fat pad removal. That buzz on buccal fat pad removal has started coming down, and buccal fat pad removal is no longer a fad as much as it's necessary in some people to get a little bit more definition in this region of the cheek. However, it's not just going on as a willy-nilly procedure that's just added on to everything. 4, lip lifts. Lip lifts are in. So the lips kind of go in and out of fashion. I think in 2021, 22, there was a lot of buzz about a lot of fillers in the lips, overfilled lips. That was really in. We're going back to a more natural looking lip. Don't want it overfilled, but people are still looking for a little bit more red show and looking to surgical options like lip lifts. Finally, in the realm of rhinoplasty surgery, I think this is a very exciting field because what's happening is we're getting equivalent results. So we're actually being able to get maybe even better results than we've gotten in the past with less invasive treatments. So the actual surgery itself is much more, for the lack of better words, it's less destroying, it's less invasive, it's more of preservation, and that's kind of tagged in the name of most of these procedures. One of the techniques that I use is called dorsal preservation, which in the name itself is something to preserve structures rather than destroy them. Has the definition of a beautiful nose changed? In the last 10 years? No. Last 20 years, maybe. So in the late 1990s, maybe early 2000, I think that there was a lot of buzz of the over sculpted nose, the super ski slopey, super thin. That was in. It was hot. And then we kind of went away from that into a much more natural nose. And I think that the natural nose idea has persisted. And in the hands of probably most rhinoplasty experts, we're still looking for that more natural result. One caveat to this, there's a lot of buzz that's coming in from Turkey. Turkey is one of these places where they do a lot of rhinoplasty. It's kind of something that they're famous for. And a lot of the Turkish surgeons really like that sculpted look. They like the super rotated and sculpted look. And so there is some kind of reversing, going back to that sculpted area a little bit. But I think overall, we're really going towards a more natural look on the rhinoplasty. Social media is a huge impactor in the overall field of plastic surgery. Plastic surgery over time, like if we look from the 60s, the 70s, the 80s, the 90s, 2000, 2010, 2020, over time, plastic surgery in general has become more acceptable, one, and two, more available to average people. Okay, so in the old days, when you needed or you wanted a plastic surgery, and you wanted a procedure or something, there really wasn't any other option than to go ask a friend, go ask your doctor, go ask your dermatologist, get a referral, go see the plastic surgeon, and then get data, and then decide whether or not you want to make a procedure or have a procedure done. That whole schema is different today. So with the advent of social media, we are just blasting out images. We're throwing images out. We're throwing the Kardashian facelift. We're throwing out all of these various people, what they look like, what did they look like, what did they have done, how did they have it done, who did they go to? And there's a ton of words that are being thrown out. Deep plane facelift, preservation deep plane facelift. So I just received a lead. This was probably an hour ago when I checked my email, that's asking for a transoral subperiosteal dissection max lift. Okay, if you weren't a plastic surgeon, who knows what a transoral subperiosteal max lift is? Okay, I can almost guarantee you that this person probably saw a patient that she liked. She saw that, she saw the description on the photo and says, I want that. Not knowing whether or not her anatomy allows for that. Is that the best procedure for her? All these things, so therefore, I think the social media thing it's a double-edged sword. On one hand, my patients are so much more educated, which makes my life easy. On the other hand, my patients are so much more educated and it makes my job hard. If you have my philosophy of just pick the right procedure for the patient, educate them, and let the patient make their choice, life is simple. However, I think that with social media, there has also come this spurious other side of plastic surgery where they're willing to do anything. This is much more so probably in some of the Caribbean countries around here, and I've heard some horror stories coming from Latin America, got a couple of patients who had horror stories coming from Turkey, but it exists everywhere. It's not that it's isolated to these areas, but this whole craze has kind of given rise to this substandard, rapid transformation, rapid volume type of surgery, which overall doesn't serve the surgeon community well or the patient community well. Whoa, we could probably spend 5 podcasts on this. This is not a singular one answer type of thing. Okay, so what are peptides? Let's just first, I don't know if everybody knows what peptides are. We all talk about it. We don't, I don't know if everybody. Peptides are short chains of amino acids. Okay, so you've got amino acid, put a few of those together, make a chain of those, you get peptides. You put peptides together, make longer and longer chains, you get proteins. Okay, So peptides is a very, very interesting kind of new horizon for medicine, but also for plastic surgery. And why? So overall in medicine, I'm sure everyone listening to this podcast has probably heard of semaglutide. They've probably heard of tirzepatide, the GLP-1s. These are common names. Those are all peptides. All of those are peptides. And, they go, oh, yeah, it helps me lose weight. That's one function of the GLP-1s. And yes, in a patient who's tried everything, is unable to lose weight, is pre-diabetic, high risk for heart disease, it's a fan-freaking-tastic medication. I mean, it really allows them to lose weight effectively, bring down their diabetes risk, bring down their cardiac risk, all these different things, right? Now, again, as we just talked about this spurious underworld of plastic surgery, kind of like the plastic surgery cabal, there's that same thing where you now see people on billboards, do you need tirzepatide? Yeah, for $1.99, we'll send you tirzepatide, whatever. You've seen it. So it's kind of gone crazy. Peptides, if used correctly, I think are extremely, extremely useful, and they have a lot of medical benefit. We currently don't know everything about them. There's a lot of research going on, but one very exciting kind of field is this whole regenerative medicine. I'm sure most of the people listening to this podcast have heard me talk about fat transfer and all the benefits of fat transfer. And one of those benefits was the stem cell component of fat transfer, which regenerates tissue. This is one of the most up-and-coming hot topics in plastic surgery. Patients are requesting for not just having plastic surgery procedures, but delving into this regenerative side where they're seeing results long-term, not just a one-time get it done and over, but things that can help them in the long term. Enter peptides. Peptides is part of that milieu that can potentially help healing. It can potentially help turn down the clock of how quickly you age. It's all of these various things like glutathione. Glutathione is one of these amazing antioxidant molecules. I use it, okay? Now, but one of the things I think that is extremely important if you want to start delving into this is not something you want to just start and going, hey, so-and-so's doing it, I'm going to go do it. So-and-so goes to some, person who dispenses it out of the back of the truck, I'm going to go do it. If you're going to go do this, okay, you need to go see a physician. There are physicians that are boarded in regenerative medicine, okay? Go see them, get the data. See what the potential benefits are in your specific case. You may not need anything. So there's a lot of variables. There isn't a singular solution. And over time, as we're getting more and more data, we're able to develop stacks and customize these peptide stacks for people that can really help them recover from surgery, recover from sports injuries, recover from, daily life trauma on joints, turn back arthritis. So very exciting field. And I think it's definitely well woven into the fabric of plastic surgery. Kind of the one little secret thing that people just haven't opened the cover on. I think we're going to start bringing back some of these kind of old school treatments. And what I mean by that, specifically what I'm alluding to, is the chemical peel. Okay, the chemical peel has been around for over 100 years. Okay, it's not anything new. People forgot about it. They forgot how cool it is and how many ways it can be used and how effective it is and how well it works. What essentially chemical peels do is they are removing layers of skin and giving you back fresh baby skin. When lasers came out, I think a lot of people forgot about chemical peels. They kind of put it in a box and it went into the back of the cupboard and no one really looked at it anymore. And lasers were cool and they were hot and they make fancy noises and fancy lights and it was cool. It's hot. And I think that what's happening is there's quite a bit of current research now that's showing how these chemical peels are actually working better on people's skin than lasers are. So I'm doing a lot of chemical peels I'm doing it with most of my facelifts. I'm doing very gentle chemical peels and then slowly building patients up, but the results are pretty freaking amazing. And in my hands, I'm telling you that I think it's better than what I was achieving with lasers. So I think that this is kind of one of those few little hidden things that's going to start, people are going to start seeing the buzz about. So I hope this podcast episode, it's kind of a unique podcast episode in that really talking about stuff that's hot, stuff that's coming up, trends, things that I've seen, and maybe what's going in and out of fashion. I hope it's been useful. I think the purpose of this podcast really is to trigger new questions, maybe trigger some thoughts, and generate some type of dialogue. If you have questions, you know how to get a hold of us. Look us up on YouTube, Facebook, Instagram. You know it. There's a whole bunch of ways to get a hold of us. I look forward to your responses. I look forward to your comments. Until next time, Dr. Raghu Autre, Athre Facial Plastics, on Plastic Surgery Unplugged.